And our Chip Reid joins us now from Capitol Hill. And Chip, walk us through the changes we saw made to this bill yesterday, and then take us through some of the major sticking points that still haven't been resolved.
Well, you just heard in that package, and by the way, hi, Vlad and Anne-Marie, it's going to be a long day.
It's going to be a long day, indeed.
Yeah, very long day coming up. But you just heard that under Obamacare, essential health benefits, there are about 10 of them. They're very broad. They're everything from maternity care to preventive care to hospitalization to substance abuse care. A lot of different things in there that people would think are pretty basic in a health insurance plan. Well, those must be included in insurance plans under Obamacare. The House Freedom Caucus wanted to eliminate that, so they reached a bit of a compromise in the House Rules Committee just now. They adopted an amendment that would say it's going to be up to each state if this bill passes. So you're going to have 50 different versions across the nation of what is required to be in these plans. As for what the sticking points are now, I tell you, it really is very amorphous because they were in the fairly early stages of negotiating all of this, and Donald Trump pulled the trigger at what politicians would say is just the beginning, really. But he wants a vote now. He's tired of all the back and forth. But on the Freedom Caucus side, the conservative side, they wanted to go beyond eliminating essential benefits. They wanted to get into the real core of this bill. They want to eliminate some of the things in Title I of the bill. Pre-existing condition mandate that you can't deny insurance because of pre-existing conditions. Some of them want to do away with the provision that allows kids up to the age of 26 to stay on their parents' insurance. Some of them want to do away with the provision that says you can't charge different rates for men and women. But they didn't really have a consensus position for the Freedom Caucus. It was very amorphous, early stages of negotiating. Everybody had their own opinions. And on the moderate Republican side, they're just concerned about this prediction by the Congressional Budget Office that over the next 10 years, 24 million people will not have insurance who would have had it under Obamacare. So they want Medicaid not to be so drastically cut. And they want the subsidies, in this case tax credits, to be more generous. But again, even on that side, it was each individual had his or her own position. There was no specific set of arguments that each side had and specific sticking points. It was really pretty vague.
So we just mentioned the whip counts, 35 Republicans who say they're probably going to vote no. That means that Speaker Ryan needs to change the minds of at least 13 lawmakers. When you describe just the variety of things that the lawmakers who are voting no, the variety of changes that they would like to see, it makes me wonder just how difficult of a task this is going to be. How likely do you think it is that Speaker Ryan will be able to change enough minds by the time the full vote happens?
Nobody knows.
Yeah.
I'll tell you, even the professional vote counters in the House do not know which way this is going to go. As you said, 35 people still tell us that there are no votes, but they're being worked very hard. And I'm sure they're all thinking, well, maybe the president is serious when he says that this is going to be the last train leaving the station. A lot of them don't believe that. They believe that, yeah, they may turn to tax reform if this bill fails today, but they can come back to Obamacare at some point in the future. So, but I tell you, it really is impossible. And that 35 number, by the way, only includes people who told us they are no votes. It doesn't include people who said they're probably no, maybe no, and undecided. So it could be a lot more than 35. And I think if this bill does look like it's going to fail, if you get to the end of the vote and it's clearly going to fail, I think you're going to see a lot of people voting no because they don't want to have voted yes on something that could come back to bite them in the elections next year.
Chip Reid on Capitol Hill. Thank you so much, Chip.
My pleasure.